We are hearing about providers, we know of providers who have very strict policies in place about visitors, but are ensuring that family members, limited numbers, are able to be there in an end-of-life situation when one of their loved ones is dying, who are ensuring that the spouse of 50 years or the daughter of many years who has been coming in regularly to a patient with dementia, keeping them calm and assisting with their complicated feeding, that is continuing with full strict hygiene precautions. So those things are happening. What we are also hearing are examples where that doesn't happen, where family members are dying alone, where family members are behaviourally distressed, residents are distressed, confused, don't know what's happening, and they're denying any family member coming in. We've seen some nice media photos from providers of families interacting through windows with loved ones, which is fine. Yesterday I had two cases, just in a couple of hours, of people who've been denied being able to stand outside a window at a nursing home and communicate with their loved one, show them their dog. These things are happening as well. What the Prime Minister, what the National Cabinet has said is that you need to look at these things on a case-by-case basis. You need to exercise compassion, and you need to follow the standards that we have in Australia for our aged care system. That's what we want to see. It's not open slather, and people who come into nursing homes have to do so under the very strictest conditions and in very limited numbers. But there must be these exceptions, and providers, too many providers still are not doing that.
So what is your advice? Obviously, this is very difficult for providers, Ian, because we've seen a number of deaths in nursing homes due to COVID-19. But of course, loneliness is a big issue at the moment, and we all want to see our loved ones, especially the elderly.
Yes, so it is a big issue, and we agree totally with the safety precautions. If you are able, as a provider, to safely take your staff in and out of the facility every day, you are also able to take a limited number of visitors in and out every day, and you should be communicating and facilitating communication with families. I'm telling you that we have many providers who are not doing that, too many providers. Not all of them. There are many who are doing great work and who are enabling that kind of contact. It's not difficult, and what the Aged Care Quality and Safety Commission is saying is to providers who be like this, look down the road at your colleagues who are doing this. Why aren't you doing it? And if families are concerned, they can contact the Aged Care Quality and Safety Commission complaints line and record it and get action about it. But we fully respect that providers need to keep their residents safe, but that also includes keeping them safe emotionally. They're getting reports from doctors that people in residents in nursing homes are deteriorating because they have been completely cut off from contact with their family. That's equally of concern. What all of us can do in Australia, can I say, is keep the social distancing arrangements in place, listen to the Prime Minister and Premiers, because if there is no COVID circulating in our community, it won't circulate into nursing homes. And the very low rate we've had of infection in our nursing homes is because we have such declining and low rates in our community.